Switching now to our third Midday Forum, and joining us is Dr. Adnan Khalid with CHI Health Nebraska Heart. And today we're going to be talking about the importance of heart health, and we're calling this segment Know Your Numbers. What exactly does that refer to?
So, as you see, you know your phone number, your PIN number, and various other passwords. But it's important that you need to know the most important numbers in your life. Knowing them can help you detect your future risk of cardiovascular disease, diabetes, high blood pressure, high cholesterol. Knowing them can help you make changes to improve your health. Knowing them could potentially save your life.
Sure, and some of these numbers, they're easy to find out.
They are very easy to find out. I mean, you can go to a pharmacy, you can go to your doctor, they can check these different numbers like your blood pressure, your cholesterol, your blood glucose. And knowing these numbers now and acting on them can help you save a lot of future medical costs.
And you did mention three of those numbers right there. What are the most important numbers for people to know? You talked about blood glucose, so that's sugar, potentially diabetes, things like that with that number. What are some of the other numbers?
So let's start with the blood pressure. I think that's one of the most important numbers. It's more of a silent killer because it does not cause any symptoms. So the normal blood pressure number is 120/80. Anything higher than that increases your risk of heart attack, and what's more important is it increases your risk of stroke. You know, there was a study that showed any number higher than 115 increases your risk of stroke. So it's 115, 120/80 is the baseline. Your blood pressure should be lower than that. Also, high blood pressure means your brain, kidney, or other arterial disease as well. So unfortunately, 1 in 3 US adults, that's roughly 74 million people, have high blood pressure or what is called as a pre-hypertension. And you know, in the past few years, we've learned that the risk of death due to high blood pressure rose by more than 48%. And as I mentioned, it's a silent killer. You don't have any symptoms until you have some complication. So it's very important for the audience and everybody to keep checking your blood pressure at frequent intervals at your home, at your pharmacies, at your doctor's office, and try to keep them under these numbers of 120/80.
And then when it comes to the other numbers, do you recommend that not only go to the doctor to get a physical, but maybe get some blood work and some other things?
Exactly, yes. When you go to your doctor, you know, you should get your cholesterol checked. You know, let's just talk about cholesterol. So you should get your cholesterol checked at least annually. And if the numbers are high, then you should check it more frequently. So what do you mean by cholesterol? So it's a fatty substance that can stick inside your blood vessels and cause blockage in the heart vessels, your vessels to the brain, your vessels to your limbs, and can cause a lot of problems. So your total cholesterol should be less than 180. And you know, it's not only important to know the total cholesterol, it's important to know what is a good cholesterol, known as HDL, and a bad cholesterol, known as LDL. So the optimal value for HDL is 60, and the optimal value for LDL, they say, is 100, but now we're learning that it's 70 or as low, the lower the better. So, but you know, adjusting these numbers or altering these numbers with medications or diet and exercise can have profound effects on your cardiovascular health. Like increasing your HDL by 1 point can reduce your chance of heart attacks by about 2%.
There you go, definitely good to know. Thank you so much for joining us. And we will be right back with a recipe from the test kitchen. You're watching Channel 8 Eyewitness News Midday.